My name is Prof Stuecker, and together with the vascular surgeon Professor Mumer, I manage the vein center of the dermatological and vascular surgery clinics of the Ruhr University Bochum. We focus on treating varicose veins, and today I will show you an operation on a patient I examined 5 weeks ago. We will be performing a particularly gentle laser procedure here. The procedure is performed on an outpatient basis, which means that the patient is only with us for a very short time and can then go straight home.
My name is Stephanie Thomas. I'm 49 years old and I'm here now for a procedure on my varicose veins. Pain was actually not the main issue, rather sometimes a swelling of the legs in the evening, but it is mainly a cosmetic problem. My mother was operated here in the vein centre many years ago with a very good result, so I decided to come here as well. My main concern would be, of course, that the complaints, which are rather mild, improve, but also that the cosmetic outcome is good.
Due to the pandemic, patients want to have as few contacts as possible and spend as short a time as possible in our outpatient clinics and operating rooms. This is ideally achievable by means of laser treatment, where a very effective treatment can really be carried out with very few staff, in a short time, so that few contacts and few risks of infection can occur. Then here we go. Now we see here on the ultrasound the great saphenous vein. We can see it very well right now. And now the puncture is performed, here under ultrasound guidance. Is everything else okay with you?
Yeah, great.
Oxygen and pulse rate are also optimal. I always have a bit of an eye on that here. You can now see the 2 rings of the 2-ring fiber in the radial technique on the skin, and we are now inserting it into the leg. You can see very clearly how the positioning laser glides up to the groin. Now the local anesthesia is applied. This can be the most unpleasant part. If you say this is too unpleasant for you, we can inject something to calm you down, but often that is not necessary. And I always have an exact overview here on the ultrasound. You are looking at it with great interest.
You don't see that every day, but you're awake and can observe your own operation.
Then we start now. You can see very nicely how the catheter is retracted here, quite precisely at 1 millimeter per second. Do you feel any pain? You don't feel anything? Well, that's exactly how it should be. While the laser is firing, we can now continue working down here on the lower leg. That's the beauty of the pullback device, that you can continue to work in parallel as a surgeon.
Als Operateur weiterarbeiten kann. Ja, dann machen wir das einmal an jetzt, das Licht. Das ist eben das Elegante.
The elegant thing is that while the local anesthetic is being applied and the mini phlebectomy is being performed, the pullback by the machine can be performed in parallel, in a completely standardized way. And this works particularly well with this new laser wavelength of 1940 nanometers, because the laser probe no longer sticks to the vein. Here are small side branches that we now have to remove. They are so tortuous that you can't get through them with the laser, so they are removed from the outside. But that's the nice thing, that we now have this automatism so that we can really work in parallel. Before, with the old lasers, it was a bit more complicated because you had to pull them yourself before you could do the rest. The shorter the operation time is for the patient, now turn off the laser please, the shorter the procedure, the more comfortable it is for the patient, of course. Now you will get a bandage, and then you can take the bandage off yourself tomorrow morning. After that, you can wear the compression stocking. We always recommend that for 1 week during the daytime. That is very short, yes, exactly. That is also the beauty of this minimally invasive procedure, that you should only wear compression stockings for a very short period of time. Now it is 10 o'clock. Then we always recommend after half an hour to have the needle pulled out, and then you can also be picked up.
Great. I didn't expect it to be done so quickly.
But you can see nicely here that we didn't leave a big wound, but that this is a really minimally invasive and basically also quite bloodless procedure.
I have to say that the whole process was quite professional. I was informed about every single step that was made and was also very surprised that it went so quickly, that you can work in parallel, this laser therapy and the small phlebectomy that was done on the lower leg. And I can recommend it all around, I must say, because it was well organised and the operation was not painful at all. Only a small prick with a local anaesthesia. Not bad at all.
For more information, please contact us